Timolol Maleate Gel-Forming Solution is used to treat high pressure inside the eye due to glaucoma or other eye diseases. It helps to prevent blindness by lowering the high pressure inside the eye. This medication works by decreasing the amount of fluid within the eye. It belongs to a class of drugs known as beta blockers. It is important to take this medication as directed by your doctor. The usual dosage is 1 drop in the affected eyes once daily. It is best to take this medication at the same time each day to help you remember. Before you start using Timolol, make sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Usually, this medication is used once a day in the affected eyes. Make sure to apply other eye medications at least 10 minutes before using the Timolol gel solution. Before applying the eye drops, wash your hands. To prevent contamination, do not touch the dropper tip or let it touch your eye or any other surface. If you wear contact lenses, remove them before using the eye drops and ask your doctor how long you should wait after using this medication before putting in your contact lenses. When using the eye drop bottle, ensure the cap is on tightly, turn the bottle upside down, and shake it once before each use. You do not need to shake the container more than once. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Hold the dropper directly over your eye and place 1 drop in your eye. Look downward and gently close your eyes for 1 to 2 minutes. Place 1 finger at the corner of your eye, near the nose, and apply gentle pressure. Try not to blink and do not rub your eye to prevent the medication from draining out. Repeat these steps for your other eye if directed to do so. After each use, make sure to replace the dropper cap and do not rinse the dropper. Use this medication regularly at the same time each day to get the most benefit from it. Keep using this medication even if you feel well, as most people with glaucoma or high pressure in the eyes do not feel sick. Some common side effects of Timolol Maleate Gel-Forming Solution may include temporary blurred vision, burning, stinging, itching, redness of the eye, watery eyes, dry eyes, feeling as if something is in the eye, or headache. If these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as dizziness, eye pain, swelling, discharge, slow or irregular heartbeat, muscle weakness, changes in mental or mood, coldness, numbness, or pain in the hands or feet, vision changes, unusual tiredness, or weakness. In rare cases, a serious allergic reaction may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before using Timolol, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have lung disease, certain types of irregular heartbeats, heart disease, kidney disease, liver disease, diabetes, or any other health conditions. This will help them determine if Timolol is the right medication for you. If you develop an eye infection or injury, or if you have eye surgery planned, check with your doctor about whether you should continue to use your current bottle of Timolol. They may advise you to start using a new bottle. Before undergoing any surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that this medication may affect the way your body responds to low blood sugar levels, especially if you have diabetes. Be sure to monitor your blood sugar levels regularly and report any symptoms of high blood sugar to your doctor. After applying this medication, your vision may become temporarily blurred, so it's important to avoid activities that require clear vision until it is safe to do so. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. It's important to only use this medication during pregnancy if it is clearly needed. Finally, if you are breastfeeding, consult your doctor before using this medication, as it can pass into breast milk. Drug interactions can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor first. Some products that may interact with Timolol Maleate Gel-Forming Solution include oral beta blockers, such as propranolol, clonidine, certain antidepressants, including SSRIs such as fluoxetine, digoxin, epinephrine, methyldopa, quinidine. Be sure to discuss any concerns with your doctor or pharmacist. If this medication is swallowed, it could be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911. Otherwise, contacting a poison control center immediately is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include trouble breathing or a slow/irregular heartbeat. Be sure to take the appropriate precautions and seek help if needed. It's important not to share Timolol Maleate Gel-Forming Solution with others. While using this medication, it's important to have regular lab and medical tests, such as eye exams. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take double the dose to make up for the missed one. Remember to store your Timolol Maleate Gel-Forming Solution at room temperature, away from light and moisture. Be sure to avoid freezing, and keep it out of the bathroom. It's important to keep all medications away from children and pets. The solution is usually colorless, so if you notice any changes in color, cloudiness, or particles, it's best to discard the solution. When it comes to discarding the solution, be sure not to flush it down the toilet or pour it into a drain unless specifically instructed. Properly dispose of the product when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.